everyone, and thanks so much for joining us as we go forward in discussing aspects of the worst healthcare and economic crisis in our lifetimes. There is so much to talk about, but I want to begin in a few minutes by introducing you to three medical folks who are on the front line of the crisis. And I think all Americans understand how deeply grateful we are to doctors, nurses, and other medical personnel all across this country who are putting their lives on the line, literally, trying to keep us healthy and treat those who are suffering from the pandemic. So we thank all of those doctors, and we're going to be hearing from three medical personnel in a moment. We're going to be hearing from Zinni Cortez, who is the president of the National Nurses United, the largest nurses union in the country. We're going to hear from Dr. Jeff Zilberstein, who is vice chairman with the Department of Medicine at the Division of Critical Care at Southside Hospital of Norwell Health in Bayshore, New York. We're going to hear from Dr. Esty Shambleman, who is the Vice President and Chief Medical Officer of Sinai Hospital at LifeBridge Health in Baltimore, Maryland. We also are going to have some music, which will help us in the transition. The nature of our technology is we can't go directly to our panel. We got to take a little bit of a break for music, and then we go there. And we thank very much Alex Ebert, who is a lead singer-songwriter for the band Edward Sharpe and the Magnetic Zeros. And later on, we thank Lissy for the music that they are providing us as well. I just want to say a few words before we introduce our doctors and nurses. And that is, all of you are aware that on Wednesday, the Senate passed the largest stimulus package in the history of this country. The House did the same today. This is a far, far from perfect bill, and I strongly believe that this legislation, which is called the Coronavirus 3 stimulus package, will be followed by another package, a number 4, within the coming weeks or month or so. The reason is that there are many gaps in this bill that must be filled if we're going to take care of the American people. What this bill does, as I think many of you now know, provides substantial sums of money to American workers, and that is, it provides a substantial increase in unemployment compensation. And what it does is expand unemployment to cover people who have not historically been covered by unemployment. Over half of our people are not covered. What this bill says, if you are a worker, you are covered. If you're a gig worker, if you're an Uber driver, if you're working part-time, if you're a waitress, you are now covered. So that bill will provide the most significant increase in coverage that we have ever seen in this country. What it also does is, through a $250 billion allocation, it also, for 4 months, will increase the amount of money that people who are unemployed receive by $600 a week. And that is a significant step forward. What the bill also does is provide, for the first time, direct cash payments to working people and their kids. And that is, under this bill, most Americans will receive a one-time cash payment of up to $1,200, up to $2,400 for a married couple, and up to $500 for each child. Somehow or another, should not have been the case. These are only kids 16 or under. Hope to rectify that in the future, but that is the case. Furthermore, this legislation will provide substantial help for small business. We're talking about $350 billion provided in loans to small businesses. Those are loans that could be forgiven if these businesses do not lay off workers or expand employment after the crisis is over. So the goal here is to keep people in small businesses on the payroll. This bill also provides over $150 billion to states and to cities, many of whom are cash strapped right now because their tax revenue has significantly declined. This bill provides over $100 billion to reimburse hospitals and medical providers for lost revenue related to coronavirus. I think we'll discuss tonight how many hospitals around the country are being overwhelmed with patients coming in with the virus. Hospitals are losing the normal source of revenue. They are in trouble. We don't want hospitals shutting down right now. Now is not the time for that. And we provide over $100 billion. This bill also provides substantial help for childcare, for affordable housing, to help our veterans, and in many other areas. The goal here, simply stated, is in the midst of the worst economic downturn maybe since the Great Depression. Nobody knows, but we do know that last week, 3.3 million people applied for unemployment. There are estimates that by the end of June, unemployment in this country could be as high as 20 or 30%. And the goal right now is for the government to make whole, to protect all of the working families in this country. And the crisis is that we are living in a nation where half our people are living paycheck to paycheck. Those paychecks are now stopping. People are being laid off. We've got to make sure that they get the help they need as quickly as they possibly can. Now, in that regard, one of the things that we are working on is to make certain that the federal bureaucracy works as carefully as it possibly can, as aggressively, as quickly as it possibly can. Under normal circumstances, getting out this much money quickly would be a serious problem. These are not normal circumstances. Far more people are applying for help. Many workers who would administer this program are staying home because of the coronavirus. So what we have got to do, and I've just spoken to the Democratic leadership a few hours ago, we have got to be as aggressive as we can in telling the Trump administration, do everything humanly possible to hire the people that you need, to get the technology up that you need, so that we get this money out to people who are in desperate need of that money right now. Workers, families, small business people, hospitals, cities, towns, they need the money now. Let's get it out as soon as possible. Later on in the show, we'll talk about how we can, where you might be able to go to learn more about how you can apply for the help you need. And one of the crises we have that we want to overcome is that many of the unemployment office telephone lines are not responding because so many people are calling and they're not responding to the calls that are coming in. The websites are crashing, and this is something we've got to work on. But later on in the show, we'll get you some specific information as to how you can apply. Other issue that's on my mind, maybe we'll discuss it with our medical folks, is we have a president who thinks that in a couple of weeks, so by Easter, the country should be back running. People should be going out to work. People should be going to all kinds of functions. I personally think that that is enormously dangerous. We'll get some expert opinion today. I think if we're going to beat this crisis, we need to continue social distancing. We need to do everything that we can to prevent the spread of this disease. But that's something that we will talk about in a moment. But right now, let us take a break. Let's go to the music, and in a few minutes, we'll be back with our medical personnel. And let me very much thank our music, Alex Ebert, who's going to provide music for a few minutes, and then we'll get back to our panel. And what we will do, we're going to hear from each of our panelists. We're going to engage in a general discussion, and we have the time to take questions that you might call in. So thank you all very much. Let's hear from the music of Alex Ebert, and then we'll get to our panel in a very few minutes. Thank you all very much.
Doing all right out there in your quarantines, and that you're keeping healthy and positive and courageous. This is a song called Stronger. And it's about, no matter what happens, no matter who tries to throw up blockades, no matter what failures, they all keep making us stronger. That's the goddamn truth. This is all I got to make music with right now, y'all. Oh, you're making me stronger, yeah. Oh, you're making me work, work, work. Oh, you're making me stronger, yeah. Oh, you're making me work. You help me realize our hearts can change. You help me synthesize harmony from pain. Let's make it a little faster. Oh, you're making me stronger, yeah. Oh, you're making me work, work, work. Oh, you're making me stronger, yeah. Oh, you're making me work. This thing's crazy, y'all. Very finicky. You make me realize our hearts can change. You help me synthesize harmony from pain. Come on, come on. Oh, you're making me stronger, yeah. Oh, you're making me work, work, work. Oh, you're making me stronger, yeah. Oh, you're making me work. One more. Oh, you're making me stronger, yeah. Oh, you're making me work. You help me realize our hearts can change. You help me synthesize harmony from pain. Oh, you're making me stronger. Let's break it down. Oh, you're making me work, work, work. Oh, you're making me stronger, yeah. Oh, you're making me work. Be well, y'all.
Let me thank Alex Ebert for the music, and now let's get to our panel. We have three panelists, medical professionals who are on the front line in fighting this pandemic. Cindy Cortez is the president of the National Nurses Union, the largest nurses union in the country. Dr. Jeff Zilberstein is vice chairman, Department of Medicine at the Southside Hospital of Northwell Health in Bay Shore, New York. And Dr. Esty Schabelman is the vice president and chief medical officer of Sinai Hospital at Lifebridge Health in Baltimore. All right, let me start off with Dr. Zilberstein, if I might. We are hearing and reading about the fact that medical personnel all across this country are lacking the protective gear that they need to do their jobs and to protect their health. I think health. In Italy, dozens of doctors and nurses have already died. And what we're seeing in this country is doctors not having and nurses not having the masks they need, not having the gloves they need, not having the gowns they need. We're seeing a lack of ventilators. We are seeing other basic equipment not being made available to hospitals right now. who are being, in some cases, overwhelmed with patients. Dr. Zilberstein, what's your sense of that? What's going on from your perspective, and where do we have to go?
Well, thank you for having me on. I've read the reports and I'm equally troubled, and even more so. I think that we have to protect the people on the front lines. If there's no protection for the people on the front lines, we will spread it, and we will spread it to others, and we will get sick. And that's clearly not the best scenario. We've been fortunate at Southside Hospital and Northwell Health that we have all the PPE that we need currently. And Northwell has been kind of ahead of the curve in terms of acquiring these things, which we're very fortunate about. But I've been reading these troubling stories about how many other health systems have been really completely overwhelmed by the need. It's imperative that every health provider get the protection that they need. Otherwise, it's impossible to care for these patients.
So your point is it's not only a question, which of course we must do, protecting the health and lives of medical personnel, but if we do not, if they get sick or worse, how are we going to protect the American people in general?
Absolutely. I mean, I've told my team this as well, because medical professionals generally are selfless. We run in when the fire is on, we run in and we try to save lives. I've told my team we have to be careful, because being selfless is being stupid. Because if we go and expose ourselves, we're exposing others, and then we're also exposing ourselves and our families, and then we'll be out for 2 weeks or longer or get deathly ill. So we have to be careful with all of this, and this all comes down to preparing and getting our medical staff the equipment that they need. That's absolutely essential. And we've been very fortunate at Northwell Health. Our leadership has been above and beyond getting the stuff that we need. But I've been reading these terrible stories of other comrades in arms who have been lacking the things that they need. It's horrifying.
And what we are seeing is hospitals and cities and states being forced to compete with each other for the limited resources they need, which is pretty crazy.
And that's where the federal government can come in, because I mean, you don't want one state outbidding another state, and so that's clearly where we need additional focus.
Okay, let me jump to what we'll do is, if you could stay on, I want to hear from everybody. We'll have a general discussion. We're going to open up for some questions from our viewers. Dr. Esty Shabelman is the Vice President and Chief Medical Officer at Sinai Hospital in Baltimore, Maryland. Doctor, thanks so much for being with us. Can you give us a sense about what's going on in your hospital in terms of how you are responding to the crisis? All right, I'm having a difficult time hearing you, doctor. Are you talking into the microphone there? All right, I'll tell you what, I'm going to go back to you in a moment, but we'll figure out what the problem is. Let me go to Zinni Cortez, who is the president of the National Nurses United Union. Zinni, thanks so much for being with us. What's your sense of what's going on?
Thank you so much, Senator, for having me. A frontline nurse, I am very frustrated and I am very afraid. Not because I am faced with taking care of COVID positive patients, but because I go there unprepared, unprotected. While we do have masks that are available, but it's not the right mask that's needed to care for the patients. And we use gowns that are not up to the level of what we need in order to take care of them. And it's really frustrating for all of us, because as nurses, we do not have the luxury of picking and choosing which patient to take care of. We take care of everybody. We take care of all the patients, but we need the proper gear, the proper equipment to safely take care of our patients. And like what has been said before, if we get sick, there will be nobody there to take care of our patients. And just a couple days ago, our hospital was threatening to discipline nurses or even to fire nurses if they brought their own gear, because the nurses were using, we were using our professional judgment to see what we needed to take care of the patient. And so we were bringing our own N95 masks, and the hospital had threatened to fire those nurses who were bringing their own gear. They were looking to the guidelines, the preventive measures from CDC, and CDC had said a bandana or a scarf is good enough to protect us from the patients. And we know that's not right.
Did CDC really say that?
Yes, and that was, we were hoping that the CDC would be there to protect us, the frontline workers, and yet they failed to do that. And so we are really scared. We are really anxious because, it's like you wouldn't send a fireman to fight a fire with a squirt gun. And why are they doing it to the nurses? But, we will be there for our patients no matter what, but please help us do our jobs safely. We will take care of the patients no matter who they are, but we need the proper gear and the proper equipment, the proper training, and the proper amount of staff to safely take care of our patients.
Cindy, the NNU represents nurses all across the country. So what are you hearing from nurses around the nation?
Nurses around the country has been saying the same thing. We do not have the proper gear. We do not have the training. We do not have the proper amount of staff. And if I may say, a couple of days ago, we were on a global Nurses United conference call. 28 countries, leaders from 28 nations coming together to talk about this. And you should have heard what the nurse from Spain and Italy was saying. And it's really heartbreaking. We are in a trajectory. We have not seen the uptick and the surge, and we are not prepared. The nurses are not prepared. The hospitals are not prepared. What we need as nurses, again, is the proper protective equipment, the right training, proper training, and the proper amount of staff.
Cindy, let me ask you this. Above and beyond the necessity, of course, of making sure that all the nurses and doctors have the protective gear that they need, what about the number of medical personnel available to treat the crisis? Are people working long hours now? Are they becoming exhausted? Do we have the number of doctors and nurses that we need to respond to the epidemic that we're seeing?
Right now, I think we're fine, but again, when we see the surge and the uptick of the patients coming in, it will probably be a problem. We have shortfalls in having unlicensed assistive personnel to help the nurses in the front lines, and I'm hoping that there will be enough of us to be there to safely take care of our patients. And we need the gear. If we do not protect ourselves, we won't be able to protect our patients, and there will be nobody there to care for them.
Senator, I can kind of jump in here. I've been overwhelmed because our ICU has gone up by fourfold, 4 times the number of patients we've normally been having to take care of. The number of calls I've gotten to help with coverage from physicians and physician assistants and nurse practitioners, critical care nurses, the gamut. This has actually been a rallying cry for healthcare to actually put the care into healthcare. I've been overwhelmed and inspired by my colleagues. I think that I've been overwhelmed by the amount of people that have jumped into the fire to help us take care of these patients.
So Jeff, what are you saying that you're hearing from other hospitals and medical facilities who need help right now, professional help?
Yes, so I'm very close in contact with all 23 hospitals within Northwell Health. We have been on the phone twice, 3 times a week. We're texting all the time. We're in communication. We're sharing resources. And so big systems have been able to really leverage that to really assist other hospitals. And so we're doing that really on an hourly basis, kind of allocating resources based on the need at the time.
Do you have a sense, and somebody else, I think we're going to get Dr. Shableman on in a minute, but Eric, Jeff, do you have a sense as to whether or not we actually have enough medical personnel, doctors and nurses and others, to deal with the upsurge in patients coming into hospitals?
I fear for other hospital systems. Our hospital system has been resilient because we're a big hospital system and we work well together, but I fear for that because if you're a small hospital, you have a couple of intensivists. This surge would have been untenable. We've been able to call on other colleagues to help.
Okay. All right, let me bring let's hope the technology has improved. Let's bring Dr. S.D. Shableman into the discussion. Doctor?
Hey, can you hear me?
Much better.
All right.
All right, you're sounding great. All right, how does the world look from your perspective?
So our ICUs are also getting full, and we're starting to notice here in Baltimore that we're a little bit behind our knowledge of how fast this disease is spreading, because it takes us 5 or 7 days to get the test back. Everybody wants testing. Everyone who has any symptoms, cough, runny nose, sore throat, fever, everyone wants to get tested. And we need to be able to test them so we can accurately map where the disease is, so we can accurately, try to cut down on it. And the test is taking 5 to 7 days to come back.
Do you have, by the way, and we'll talk about testing in a moment, do you have the available tests for the people who want them?
So we have available tests for people within our network, but we're doing 500 calls per day on our telemedicine platform. We have 150 drive-through tests per day at LifeBridge, and we have 900 people under surveillance, but it's within our network. We'd like to be able to open that up to the public, but we don't have enough tests to do that. Other hospital systems in the city are doing the same thing. And there are some public ones that are opening up, but again, with a 5 to 7 day lag time, that's a lot of time for people to wonder if they have the disease or not.
So are you only at this point able to treat people within your network?
Right now, we're bringing in, we have a pretty extensive network. We have 5 hospitals and multiple outpatient clinics and providers and practices, and if everyone within that we can refer to our telemedicine program.
All right, are you prepared in your location for the possibility of a surge?
We're getting ready. We're opening up an additional 200 beds in our 5 hospital system. We're converting entire wings to isolation rooms. We're buying ventilators and equipment as much as we can get.
All right, we heard from the National Nurses Union, Zinni Cortez, about nurses not having the protective equipment they need. What kind of shape are you guys in that regard?
So we're in extreme conservation mode right now. We have enough for our day-to-day practice, but we can see that it's going to run out in the future, and we're being very, very careful with how we use it. So because of that, we've had to limit visitors, for example. We're not allowing very limited visitors in the hospital. We've sent home essentially everyone that we can send home so that they're not using PPE, the personal protective equipment in the hospital. And so we have to be very, very careful.
So you're worried about running out of masks and gowns and gloves and all that stuff?
I think every hospital in the country is.
Yes.
And what about ventilators? Do you have enough ventilators, do you think?
So at the moment, we're okay, but we're coming up with contingency plans for how to stretch those ventilators. Right now, again, we're all right. But if this turns into Italy or China, we're coming up with contingency plans such as how to split ventilators between patients, how to stretch ventilators that were meant for short-term use or transport use for longer-term use, because people with COVID-19 end up on ventilators for a lengthy amount of time.
All right, and anybody who wants to jump in, please do. What are you hearing from your colleagues all across the country about what might be happening in the next week, 2 weeks, month? What are we looking? I know nobody fully understands it or can predict it, but give us some best case, worst case scenarios of what we might be looking at in the future?
Well, I think that the biggest concern is that if we're continuing to surge, we will run out of equipment. So the greatest hope that we have is that we have fewer patients come in. The way to have fewer patients come in is to continue to separate so that you're not going to get it. The fact is that there are quite a few asymptomatic shedders, which means that those are folks that are infected yet not feeling ill. That's why this virus is just so darn smart, is that it doesn't just kill you. Instead, what it does is it stays in you, and most of the people are fine or they just have minor symptoms.
All right, stay on that for a moment. Anybody else who wants a terrible, terrible virus, so somebody can be walking around without symptoms and they could be spreading the virus. Is that the case?
That's precisely the case, and that's why it's so dangerous, and that's why people can get falsely reassured, still have some friends over, still think that this is not an emergency, and they're not seeing what's going on inside the hospitals. They're not seeing the rest of it, and that's why I really thank you for putting a spotlight onto this.
I think one of the issues that we are facing is that in the hospitals, if the patient is just considered a PUI, patient under investigation, the safeguards are not followed as if they were positive. And that's a cause of concern because the healthcare workers could be the vectors, we could be the carriers, and we could be spreading it, if we're not given the proper gear. So we just need to be cautious, and we need to be careful.
To take that a step further, we need to treat everyone as if they're infected, because again, we have people who are asymptomatic and shedding. And so you can imagine the stress that puts on a system. For example, we have 14,000 employees, and previously we were using, each employee was using a mask or 2 or 3 a week. And now we need to use the mask and the gown and the gloves with every patient in order to be safe. It's putting a lot of stress on our healthcare system.
Right. But unfortunately, that's not what's going on in most of the hospitals. And from what we're hearing from the nurses, that's why the nurses are asking that we need to consider each patient positive until it's proven otherwise. That's the only way we could prevent the spread. And yet, the people that are making decisions in the hospitals and in our own government, which makes me really upset, they don't listen. They base it on profit. They base it on the money and the stocks. It's not. These are patients' lives. Why are we risking lives? Not only of our patients, but of the frontliners.
Let me get some expert opinion here. What I understand, the most knowledgeable epidemiologists and experts are telling us is that we now have to be extremely aggressive in terms of social distancing. And not to be very political here, we have a president who says, well, hey, maybe by Easter time, everything's going to be up and fine and come to work, go to church, not a problem. What's your sense about that?
Well, Senator,
why do you think something, or is that pretty stupid advice?
With all due respect, I'm 6 feet away from the monitor right now. I think that we all need to continue to be socially distant from one another as best as we can. And we know that because of all the asymptomatic shedders, we all are at risk anytime that we're exposing each other. And so it's imperative that we flatten this curve so that healthcare can continue to function in the way that it currently is. We're continuing to be strapped. And as I mentioned, we have 4 times the number of ICU patients in non-ICU locations with a lot of people helping. It's been remarkable. Now, if we have 8 times as many ICU patients, now that's going to be a real problem. And so we continue to compound it. What we'd like to do is flatten this curve because we can take care of the patients we're taking care of. I don't want to have a situation in 2 weeks where it becomes catastrophic. Right now, we're handling it very well. We want everybody to stay safe and stay home.
Does anybody here on the panel think that it makes any sense to try to return to normal in the very near future when we have a major pandemic on our hands? Doctor, or is anybody want to jump
No,
in?
we can't return to normal. We can't. Like one of our colleagues have said, you know, we need to maintain that distance. We need to maintain um, communication amongst ourselves because, you know, it's the virus, like he said, it's smart. We need to protect ourselves, you know, and we need to be smart about this. So the less of us we have contact with each other, the better off we are. We need to base our decisions on science and not on the stock market.
Yes.
All right, anybody want to add any more to that? And I think almost everybody in the country understands that, agrees with that, except the person who happens to be in the White House, which is pretty unfortunate. And I should tell you that one of the things I did today was talk to the head of the AMA, because I think it's important that not only the AMA, but the other medical organizations, scientific organizations, get out there as organizations and to state what they believe to be the scientific reality of the moment and what people should be doing. This is not a time for political rhetoric. This is a time for science and for the American people to understand the reality of what we're facing. Any other, I wanted to just go back to the panelists for a moment. This must be an incredibly difficult moment on a personal level for our doctors and nurses and medical personnel. I have read that there are medical personnel who are now writing out their wills and, you know, wondering whether they're going to make it through the crisis. You guys have any sense of, well, of course you do have a sense. What are your colleagues telling you about this moment on a personal level?
I think everybody's scared. I mean, everybody's frightened. I think that I'm fortunate to be in an organization where we have enough PPE and we have enough equipment. Having said that, we're exposing ourselves. You know, we're running into the fire, and so having said that, 90% of my colleagues are running into the fire with me, 95%, and the amount of humanity, the amount of inspiration, the amount of, this is a huge silver lining. Look, this is a pandemic. This is a crisis. There's no question about it. But my colleagues have continued to inspire and enlighten me on a daily basis. And
Well,
what I see is humanity. What I see is just completely revolutionary to the thought process around healthcare, not being about documentation, but about caring about health, caring about your individual.
So
it's remarkable.
From my standpoint, you know, I'm an ER doctor and I'm willing to take that risk and I'm willing to go in there and take care of patients. It's what I signed up for. What's a little scary for me and for, you know, my community and the people I've been speaking with is bringing that home to your family, right? Bringing it home to your kids, or if you know, my kids can't see their grandparents for weeks or months because we're really worried about them. And so that's been really hard on families, and it's really hard on healthcare workers who are scared for their families. Really.
Cindy, you want to add anything?
Yeah. Yes, as nurses, we come to work every day. You know, we're so used to facing the unknown every day. But in the past, we've had the AIDS epidemic, we had SARS, we had H1N1, you know, we had Ebola. But during those times, nurses were allowed to use their nursing judgment. But now in this pandemic, we are condemned for using our professional judgment. Having to have a bandana or a scarf to cover you, I mean, come on. You know, we're not disposable. We're not a commodity. We are needed in the system to take care of patients. We are part of the healthcare team. And that's where our frustration lies. If only we can be given the proper amount of gear. Hey, come on, we'll do even 16 hours a day if needed. But
Well,
we
as
need to
you know,
have the proper gear.
as I think you know, some of us have insisted and demanded that the president implement what we call the Defense Production Act. And at this moment, what we do not need in America are more t-shirts. We don't need more underwear. We don't need more socks. What we do need is masks. We need gloves. We need gowns. We need all of the protective equipment our medical personnel should be having. And we are demanding that the president utilize this Defense Production Act. He did today, after a lot of urging, in terms of getting General Motors, I believe, to start producing ventilators. But, you'll recall that during World War II, we had companies, General Motors, Ford, other companies produce cars. But on day one, they went from producing cars to tanks and to airplanes. And that's the kind of transition we need right now. It is unacceptable in any way, shape, or form. The nurses are being asked to put bandanas to cover themselves. So the immediate priority is to make sure that all of our medical personnel have the equipment they need to protect themselves and to protect the American people. That's an issue we're working on very hard. We're obviously, as a result of this legislation, getting well over $100 billion out to hospitals, clinics all over this country to give them the resources they need to buy what they need. All right, let me go now. If anyone want to add anything to that, or do we cover it?
I would just agree. Nurses are on the front line, and it's reprehensible if they're not getting the protection that they need. In the Northwell facilities, I haven't seen that. I've read about that in other facilities. Nurses are the front line. They need to be protected, and it's reprehensible if they're not.
Completely agree.
Okay. By the way, there's another issue of concern. There are some hospitals I read today in Elmhurst, the Elmhurst Hospital, I think in Queens, New York.
Yep.
It's hard to believe 13 people died. Hospital is being overwhelmed. Do we have, and I don't know if you know this or not in talking to your colleagues, but do we have the hospitals located all over the country I worry that there are parts of this country which are really medically underserved. There are no hospitals. There are no doctors in various parts of the country. Do you have any thoughts on that? Are you hearing anything about that?
Well, I think we're all really concerned. I think that there are some hospitals that are being overwhelmed with the worried well that are coming in because they've been exposed. Right. And then they're exposing themselves in the emergency department to all these other folks. And then there are other places where there's no, kind of building in sight where they can go and get a test. So I think that my hope is that we all look at this in 6 months, try to figure out how to better structure this and learn from it. And I can't agree with you more about the idea of listening to experts. I think that there's a dearth of that. And I think that it's really imperative for everybody to understand that the public health experts need to be listened to, and we need to go based on science and not based on hunches and desires.
Absolutely. But let me ask you this question right now. If somebody is diagnosed tomorrow with cancer, or with heart disease or other serious life-threatening illness, their care is going to be compromised right now, I believe, because hospitals are overwhelmed with the coronavirus. Is that true, not true? Or?
We're already closing outpatient clinics and trying to limit the number of immunocompromised people that come into the hospital. We're doing everything we can to take care of those people through telemedicine and as outpatient, and in new ways. But certainly this virus has the capacity to overwhelm our system to the point where people wouldn't be getting the care that they need. And we're working very hard to make sure that doesn't happen. And I'll tell you one other thing, Senator Sanders, is it's not just the healthcare system that needs a little bit of tweaking. There's a social safety net underneath there that, for example, if we try to discharge a homeless person who again, doesn't necessarily have coronavirus, but has a cold, no one will take that person right now, and they're stuck in the hospital. And we've got the same problems with people in nursing homes and assisted livings, and it's hard to get people out of the hospital right now to make room for other people because everyone's so scared, really.
Is any thoughts on that?
Yes, what we're doing right now are emergency cases only. So we have forgone elective cases because we are preparing for the uptick and the surge of patients.
What happens to somebody who's 5 months pregnant right now?
So we're still having deliveries, of course. That's not going away, but the experience isn't the same. We're limiting the number of visitors that you can have. The husband can still be there, but the rest of the family essentially at the moment is stuck waiting outside because we can't take the risk that they're going to infect the baby or staff or use the PPE that we're essentially trying to keep for our frontline staff.
should people who do not have the coronavirus but are dealing with other illnesses be nervous about walking into a hospital today because of the possibility of increased possibility of infection?
If you're sick, you need to come to the hospital. So we're still open for business. We are taking care of coronavirus. We're taking care of strokes and heart attacks and traumas and everything else as well. So we are continuing to build our capacity. But again, that's the whole point, is that we have capacity, and at some point we have to say it's going to overwhelm the system. And so we need to continue to socially distance. But we are still open for business 24 hours a day, 7 days a week. Please come if you're sick. And please don't if you're not.
That's right.
That's right.
I want you raised, let me pick up on that point. We talked a moment ago about testing and the fact that it takes 5 or 6 days to get the results back now. My understanding is that there is work being done to greatly expedite that process so that people can learn within a day or less about whether they have the virus or not. That strikes me as being extremely important, because you don't want people in the hospital who may not need to be in the hospital. Is that true? What's the story on that?
That's right. Just like I was saying before, getting people out of the hospital when they're in this 5 to 7 day window waiting for a test has been extremely difficult. So if we could have a test that could turn around in an hour, like our regular test, or 6 or 12 or even 24 hours, that would expand our capacity to care for patients.
So what do you do right now? Somebody walks in with the symptoms. You don't know whether it's a virus, a bad cold, whatever it may be. You put that person in a hospital bed?
No, it depends on how sick they are. If they're well enough to go home and self-isolate, then that's what we do. If they're sick and they have a pneumonia or they're short of breath, then yes, we bring them into the hospital and then we test them, and we test the people we send out as well.
But it will be, correct me if I'm wrong, enormously important to get tests where you can get results in a short period of time to know whether or not somebody can go home or has to be hospitalized. Is that correct?
Well, so, I mean, you can actually send people home without even knowing the value of the test, whether it's positive or negative, and just advise them to self-isolate until. We actually, in the state of New York, and actually at Northwell Health, it took several days. Now we're getting 24-hour turnarounds, and we're looking to point of care within the next couple of days. So hopefully soon we're going to be able to get relatively quick, less than 24-hour results. And so that's helped us tremendously. We've really ramped up testing, and that's helped us a lot.
But you have testing within 24 hours.
For sick patients, for sick hospitalized patients, not for the folks that just want to test just because. It's if they're coming into the facility and they're sick enough to be admitted to the hospital, we have the ability to turn around that test very, very rapidly.
Yeah, and we're building the capacity now to do that. But for the moment, we've been dealing with these send-out tests that go to these national laboratories. So we're in the process of building capacity, and hopefully we'll have that up and running in a week or two. But right now, we're still stuck at the 5 to 7 day window.
Cindy, what are you hearing about the speed at which tests are being processed?
I think we have the slow speed, the 5 to 7 days for now. And the other problem that, if I may raise it, is that we do have healthcare frontline workers that have showed some symptoms, and yet they're being denied the test. They have to meet certain criteria. And so I am again frustrated because we have Hollywood celebrities, we have NBA players who have been tested, good for them. I'm happy for them. And yet you have frontline workers who are begging to be tested because they show some symptoms, and yet they're being denied.
And we'd like to get them back to work quicker, right? I mean, if we're waiting 5 to 7 days to get a test, we'd prefer to have a quicker turnaround so we can get them back to work if they were negative.
Of course.
All right, we have a few questions, I suspect more than a few, that have come in. Let me just start it off. A gentleman named Patrick Burkhardt has written, and he says, what is the best way for people who are at high risk to stay safe during this crisis?
Oh, I got it. Stay home.
Stay home.
Stay home. Wash your hands. wash all of the doorknobs and those things. I mean, so wipe down the high use items. Don't touch your face nearly as frequently as you generally do, because all of us do. Stay home, and please stay home.
Give us some examples of people who might be high risk. Who is high risk?
So what we've found is that folks with diabetes, high blood pressure, chronic kidney disease, chronic heart disease, chronic lung disease, cancers, and other things that depress the immune system, those are the things that are troublesome. We say age. Having said that, we successfully treated a patient who was 94 years old, and he's off the ventilator now. And we still have folks that are very sick in their 30s that are still on ventilators. So age is a risk factor, but it's not the only thing.
All right, let's be clear about that. I think at the beginning of this pandemic, there was some thought that it was really only the elderly that had to worry, that young people really were not in danger. That turns out not to be the case, and that's a word that we've got to get out. I think there are a lot of young people out there who are not aware of that. They think they are not high risk. Anyone want to say anything about that?
I would say that they're not high risk necessarily, but that doesn't mean that they're no risk.
They can die and they can become sick, yes?
Become sick, yes, absolutely, and they can die.
Okay. Next question comes from Layla Goring. Our question is, how can we support the medical community?
So going along with Dr. Zilberstein, the first thing you can do is stay home. If you're not sick, please don't come to the hospital. But again, if you are sick and you need help, we're open 24/7. So that's the first thing you can do. The second thing is if you're able to have access to any personal protective equipment, masks or gowns or gloves, and you're able to send that to your nearest hospital, that would be helpful for us as well.
Okay. More thoughts on that?
I have an appeal. If everybody could call area code 202-335-6015 and ask to speak with their legislator so that they can go back and work. The Congress and elected officials can go back and work and write an emergency legislation that will be protecting the nurses and the frontline workers during this pandemic. Please call 202-335-6015 and talk to your representative.
Let me jump to a question. And by the way, let me repeat, Zinni, there will be, unless I'm very mistaken, a fourth stimulus package, because there's a lot that was in this bill. A lot was missed, and we're going to have to go back and fill the gaps big time, both from a medical and an economic point of view. I worry very much economically. I don't know if you guys are running into it. People who have lost their jobs, they're worried about how they're going to survive economically. People are living under incredible stress, which I don't think makes your immune system any stronger. So we're going to have to deal with the issues you raised, making sure that our medical personnel have the protective equipment they need, but a lot of other issues out there that have not yet been dealt with. Let me ask you this. This comes from Ashley Figgs, who writes, do any experts believe that the transmission will be impacted by the weather warming up? A lot of discussion about that. Some people think that the weather warms up, the transmission rate goes down, then they worry about the fall. If you look at the 1918 virus, it comes up again. What are you guys hearing about the impact that weather and humidity might have on the transmission of the virus?
I just think we don't know enough yet.
I would agree. I think we don't know what we don't know. This is there's not enough knowledge out there to give you a good response. And again, this is science-based. I mean, at the end of the day, we can rely on hope, or we can, look to the science. And I wish I could tell you something, but I can't.
So that's an honest answer. You don't know.
You just don't know.
Probably nobody does. I mean, this virus is not previous viruses, and we don't know that it will perform the same way as other viruses have.
Exactly right.
here is a scary question. And, and I know you guys are spending your lives right now, saving lives. You're in the struggle this moment. But Jesse Hebert asked this question: will we be dealing with a crisis like this every year from here on out? Do we need to remain distant forever? In other words, I think what we have heard in this discussion, we've had a number of pandemics in recent years. This is the worst. But is there any reason to believe that this will not be the last? What does this mean? What do we do? And that's a depressing question, but I think a realistic question.
Yeah, and so let me give you an honest answer. The honest answer is, I think that we can be hopeful. This is not the end for us. I think that scientists have done an amazing job already, making a lot of strides. Northwell has already participated in a bunch of clinical trials, and already we're starting to see some effects of those. Mount Sinai in New York City is doing studies on creating other treatments, and then a vaccine will hopefully be coming soon in the next 6 to 12 to 18 months. Who knows? But there are a lot of people working on this. And so the hope is that not only with the medications and the potential vaccinations, but also the flattening of the curve, because we know how to treat it. And so as long as we don't have the volume of patients all at the same time, and then also if we're exposed, we're going to have antibodies to it. And so then our ability to fight against it the next time might be better.
All right, but Jesse Hebert raises the question. It is a depressing thought. And you're right in terms of science and medical research giving us increasingly improved tools to deal with these crises. But he is raising the question, is there any reason to believe that this is, the last pandemic? Probably not, huh?
Oh, probably not, no. I mean, clearly there are going to be others in 5 years, in 10 years, in 20 years, in 50 years. The last big one that was this terrible was 102 years ago. Right. Hopefully we don't have these every 102 years, but they're 202 years next time. But the point here is that we have to be able to flatten the curve so that science can catch up.
Exactly. And hopefully now we have the brains to start putting substantial sums of money into globally. We're not the only country dealing with this. There's got to be a global enterprise where people all over the world, the best minds in the world, are working on long-term vaccines, long-term treatments.
And hopefully we don't forget these lessons in 6 months and 6 years.
I have a feeling we will not. But let me ask you this question. Very simple question. It's on my mind. Something I try to deal with. I was not successful, but Cheryl Strobino Vaccaro asks, what about people who have no insurance? Can they still be treated? So somebody walks into your hospital, hey, I'm uninsured or underinsured. I have a $10,000 deductible. Now the legislation just passed says that the government will pay for the tests. Doesn't say that the government will pay for the treatment. All right, so what? And I have read there's some stories out there, people were sick, they didn't have any insurance, they didn't go into the hospital, they died.
So Senator Sanders, I think you're right. I think there's some fear about that, but no one should not go get help because they don't have insurance. We don't ask about insurance in the emergency department for emergency, if you have insurance, we'll take it. But if you don't have insurance, we still see you and treat you the exact same way. And if you're sick, we will see you and we will take care of you.
No, I know that, and that is enormously important. What you're saying is anybody is sick, get the medical help you need.
Please.
The problem is that some people are sitting there and saying, you know what? This treatment, depending on how long I end up in the hospital, may cost me X thousands of dollars. I don't have the money. And while I got the treatment and I'm appreciative of that, I may be spending years paying it off. That's I think the concern.
Senator Sanders, if I may say, a lot of this could probably have been prevented if only we had if patients had easy access, early access to healthcare. a lot of these could have been prevented. If our patients were not afraid of going to the emergency room or seeking help, and are not afraid of going bankrupt because of their co-payments or their deductibles or their office visit payments, these patients could have been helped in the very beginning. The symptoms could have not gotten that worse. So I really feel that if only our patients who are in the worst health right now had early access and had gotten care early on, a lot of these could have been prevented.
Well, I agree, and that's why, among many other things, I am a strong advocate for Medicare for All, as are the National Nurses United Union. There's a question from Tracy DaCosta, I guess for me, but others can jump in as well. What are you hoping to have included in future coronavirus aid bills? I think there are two areas that we have got to strengthen. Number one, we have got to make sure that our medical personnel, and that's what we've been talking about this evening, have all of the support they need to do their jobs, that our hospitals are prepared, that everybody in America understands that they can walk into a doctor's office, walk into the hospital, get the care they need. In my view, and I pushed for this, I was not successful. I think that during the emergency period, nobody in America should have to worry about a medical bill. We got enough else to worry about. So I think from a healthcare perspective, we invest in research development. We make sure that all of our hospitals have the ventilators, the ICU, the beds they need. That we also begin thinking, depending on how long. Well, let me throw this question out to you guys. And again, people, I suspect the answer is we don't know. But if somebody were to say to you, how long are we going to be in this crisis mode? Are we talking about weeks, months, years? Anybody have any expert opinion on that?
So
I'm not going to speculate.
Jeff, did you want to jump in?
Yeah, sure. I mean, I'm going to jump in to say I don't know. And it's really going to be markedly dependent on the American public. So if the American public continues to run around and live life as normal, then we will be suffering for an extended period of time. So it's really up to us as a society how long this is going to be.
Well, that's a pretty profound statement in a sense, that this crisis is dependent on the behavior of the American people. And if we self-distance ourselves, if we deal what is enormously painful for all of us, not to be with friends, for kids not to be in class, for workers not to be at their jobs, all this is just from an emotional point of view, from an economic point of view, absolutely disheartening. But what you are saying is the stronger that we are in staying the course here, as painful as it may be, in the long run, that's how we shorten the period of crisis.
So I would liken it to chemotherapy, right? Nobody wants to take chemotherapy, and it's kind of terrible. But if it gets rid of my cancer, sign me up.
Right. Okay, but this is now something that every American, healthy, not healthy, with the virus, without the virus, old or young, has got to adhere to. We are in a way that we have never been before. It's easy to say we're in this together, but we are truly in this together. If I get sick and infect you, you infect somebody else, we all suffer together.
We're all in this together, yet 6 feet apart.
That's right.
Yes.
That's right.
Okay. Other thoughts on how long this epidemic might continue? All right, no thoughts on that. All right. One last question. I don't know if we have any thoughts on this one. Honora Harbick writes, what would the medical professionals change about testing protocols besides having more tests available? Thoughts on that?
I mean, I'd like to see everyone who wants to get tested, not necessarily because it's scientifically necessary that way, right? If you just have a cold, you could stay home. But I think there's a lot of fear right? Again, like I was talking about before, fear of getting your family sick, fear of getting your grandmother sick. And if you could get tested and know that you don't have it and you don't have to be separate from them for the next 14 days, then that might help people feel better.
Let me throw this out. There is a thought among some people, which kind of makes sense to me, that before we return to normal, we might want to or might have to greatly expand testing. In other words, you're a teacher in a classroom, or you're a worker in an office or in a factory. You're prepared to go to work if you know that you and everybody else around you has been tested that morning, and you're quite sure that nobody in that environment has the virus. Does that make sense?
Well, so testing 2.0 is going to end up being maybe antibody testing, so serum testing, where then we're going to be able to say, okay, you've been exposed to the virus and now you're quote unquote immune. You're no longer going to be shedding. And so that's the hope, right? I mean, the hope is that we're not going to be continuing to expose one another as we get back to quote unquote normal life.
But getting back to normal life, might that mean that every day when I walk into my office or walk into my factory, I have been tested? Is that part of normal?
Well, it doesn't sound normal to me. I mean, I think that if you have a serum test that shows antibody, you've been exposed, which means that now and if you're not showing symptoms and you've been exposed, then it's unlikely that you're going to be a carrier. And so that's not happening today. My hope is that's going to happen soon. But I would agree that it's a little foolish to move forward without knowing what we don't know in terms of who's out there and who's shedding, right, who's infectious.
Right.
I will point out one thing that we don't know that people might misinterpret Dr. Zilberstein's comments is that we think based on other coronaviruses that if you catch this one when you get better, you likely have an immunity for some period of time. We don't know exactly how long that lasts. But if it's like other coronaviruses, it's probably not a lifelong immunity or even a long-term immunity.
Thank you. Yes.
So just because you got it before doesn't mean you're not going to get it again. Although it probably means you're somewhat protected for some amount of time that we're not sure of. So just be careful with that.
What I hope to see is a quicker turnaround of the test result.
Okay. Well, let me thank all of you. And on behalf of the American people, I think there is an immense level of gratitude and respect for the men and women in the medical profession who literally are putting their lives on the line to protect the American people. And you are the heroes and heroines of our country today, and we thank you all very much for what you're doing. And let me thank all of those who have tuned in tonight. Let's go forward together, and thank you all. See you soon. Take care.
Thank you.
Thank you.
Okay, and now I believe we have some music from a band that I am familiar with, and that is the band Lissy. Lissy, thanks so much for performing.
Hi there, my name is Lissy. I hope you're all staying safe and healthy. Thank you to the essential workers who are keeping our society running, and hopefully the rest of you are practicing social distancing, staying home so that we can flatten the curve and get through this thing together. I am a huge Bernie Sanders supporter. I've had the honor and the privilege over the last many months of being able to open for him, but also more so to get to hear him speak. And time again, his message has been so consistent. So thank you to Bernie Sanders for all he is doing right now to try and make sure that all the working people are going to be taken care of. Without further ado, I want to sing you a few songs. I am just on my iPhone in my boyfriend's kitchen. I've spent the day gardening, so hopefully wherever you are, you're able to get outdoors. My dog might bark. I apologize. Her name is Olive, and she might make an appearance, but hopefully not too disruptive of one. All right, here we go. The night has to come. This much I know as the light fades out. The wind begins to blow and I am alone and will forever be just me, just me, just me. Silence full of everything, silence full of truth. The life is happening. Oh, age and youth, if I can love you my way, then that's all I can do. And I do, and I do, I do. The past is behind me, the future don't exist. The night is inside of me, and I must live with it. There's a longing inside me, big as the ocean, about to carry me away and wash me over.